Welcome to Transform Now, the podcast brought to you by robotic process automation pioneer SS&C Blue Prism. Digital transformation has the potential to reshape the way companies service their customers, engage their employees, and manage their operations. Whether you're looking to develop strategies, tactics, or best practices to positively impact the future of work, or you're curious to see how other companies have successfully navigated their digital transformation programs, then this podcast is for you. We're here to help you transform now.
Hello, everyone. I'm Brad Hairston with SS&C Blue Prism. Welcome to the Transform Now podcast. Today, I'm happy to have two guests on the show. The first is Bryan Daniels, VP of Revenue Cycle Solutions at Indiana University Health, or IU Health, as they are more commonly called. They are the largest and most comprehensive healthcare system in Indiana and a Blue Prism customer. My second guest is Matt Gustitus, CEO and founder of Digital Workforce Solution, a Blue Prism delivery partner who has worked extensively with IU Health. The three of us will be discussing IU Health's automation journey and what success factors have enabled them to scale their solutions so quickly and effectively. Welcome, gentlemen. Why don't we start with some introductions? Bryan, why don't you go first?
Hi, Brad and Matt. It's nice to be here with you today. I'm Bryan Daniels. I have a long history in healthcare revenue cycle IT. About 20 years I've been working with revenue cycle data and systems integrations, systems development, all in order to deliver value to the revenue cycle process. And revenue cycle in healthcare is everything from registering and scheduling a patient for services on through billing and collections. And it's a fascinating area, many challenges. My team is about 100 technologists, everything ranging from systems analysts to business intelligence to systems developers.
It's great to have you on today, Bryan. Appreciate you being here. And Matt, you are a returning guest to the podcast. Why don't you reintroduce yourself to our audience?
Great. Thanks, Brad. It's nice to join you again and with Bryan as well. And as he mentioned, Matt Gustitus, been leading Digital Workforce Solutions since 2020. And really just great opportunities we're finding across many different industries, especially in healthcare, and just excited to continue to see how that's growing over and over as the years has continued. So looking forward to the conversation today.
And for those that didn't hear, the first time Matt was on, I think we talked about your famous story of saving the Final Four with automation, if I recall. And I think IU Health was even part of that story, if I'm not mistaken. Yeah.
Yes. The NCAA tournament back in, what was that, 2021?
Yeah, that's quite the story.
It is an amazing story. It's one of my favorites. It's not every day that digital workers get involved in something like that. Glad to have you both on today. Bryan, let me start our conversation with you. Could you just walk us through when IU Health began your RPA program and what was the main driver behind that?
Yeah, so RPA for IU Health has been quite the extensive journey. So prior to 2020, we had acquired RPA within some vendor solutions at a fairly large scale to post primarily remittances from insurance payers that we receive into the accounting systems. And so we do this at quite a large scale even today. And what I found is as we've progressed along, automation has become quite the buzzword in healthcare and very specifically in revenue cycle, a very administrative laden process. And so around that time in 2020, it was quite the buzzword. And as I heard about it, I thought, well, I lead a technology team and we've been providing automation in various forms for years and even inclusive of RPA. And I started exploring different vendor solutions and basically what are people really touting out there. And what I saw was a combination of RPA stitched together with some other technology solutions. But primarily it was RPA as a service is mostly what I would see. Mm-hmm. And I thought, well, we do some of this. We've always done some of it. But what I lacked was a structure and method to really control it at scale and develop it at scale. And so because my prior experience had been mainly acquiring it and applying it here and in there, I didn't really have a capacity to then develop it and deploy it in various spaces within the revenue cycle process. And so I started looking further and I determined that it was a piece of the technology portfolio that I just needed to mature. And so then that started my journey of looking for, well, how am I going to uniquely solve for that within IU Health, given that I am an embedded technology provider that does a lot of custom development, does a lot of delivery myself. I wanted to find a way to provide RPA at scale at that time.
And Bryan, what are some examples of processes that you automated as you began that journey, and how did they enhance patient care or operational efficiency?
Well, the largest use case for us was in the registration space. So when a patient seeks services, they schedule an appointment typically, and we need to collect information initially prior to the patient appearing on site to receive services. And so we call that pre-registration.
Mhm.
And when you're an existing patient and you need to have a pre-registration completed, that is a repetitive process currently where we would pull forward information that we had already gathered from you from some prior visit, re-enter that into the system, and then make any changes and then complete that pre-registration process so that when you arrive, you're ready to be seen and we can then apply any visit information to that. So we identified that as a prime opportunity early on. And actually, you had mentioned the NCAA tournament. When we had automated registration for the NCAA tournament, it was a fairly small scale set of automations, but in that same registration space.
Mhm.
So a lot of the same screens you would use to enter that data, we reutilized to say, hey, we could also use that for this pre-registration process. And that registration process is carried out across all of our organizations. So 16 hospitals and too many physician clinics to count, all utilize that process. That was a big win right out of the gate for us. Another opportunity was also within the registration process where when we check insurance eligibility for a patient,
Mhm.
sometimes that check doesn't come back clean and we have to then make modifications to the information that we have on hand. And so what we did was we utilized bot development to basically to work through alerts that we receive when that process fails. And so
Mhm.
that's also done at a large scale across all of our organization. And then one other early opportunity that we identified was updating return mail information. So when we
Mhm.
send statements out to patients, sometimes they come back as returned. And then we ping a database to see, hey, what is the accurate address? We find that address and we go and update that in the system to ensure that your statement is received at the appropriate address. And that was a 100% manual process prior to that we were able to automate. And since then, that was in the early first year of RPA acceleration for us. It's been a
Mhm.
multitude of opportunities since.
Awesome. Those are really good examples you gave, and ones that are pretty common with our healthcare provider customer base. It's great to hear that you guys went and tackled those right out of the gate. Matt, your automation consulting firm, Digital Workforce Solution, has worked closely with IU Health throughout their journey. How did you help them identify areas within their healthcare system that could benefit the most from automation?
Yeah, it's interesting, Brad. When I think back on 2020 when we were originally getting started, there was just a lot, right, to come in. And when Bryan and I were starting to talk about what the potential opportunities were, revenue cycle, obviously within his area
Mhm.
was key, right? There was so much opportunity there. Really, the biggest challenge was how do we put together a program that is sustainable? Because we know that, first of all, there's a lot of processes, there's a lot of opportunities, but we're going to have to be prioritizing them and looking at those areas specifically where we see the most value for the organization. And I think having those conversations early with Bryan and the team. He has a great team who came together and said, hey, look, we see the opportunity, we understand it, and we want to leverage this opportunity to use digital workforce to be able to assist with the work that, quite frankly, is just a lot of repetitive work that people are having to do. So then they can be freed up to do other work. And having that vision right away was core and key, and got
Mhm.
them started off on a good note at the very beginning.
So, Matt, it sounds like when you arrived on the scene, there was a backlog of automation opportunities, but your team worked with them closely to process through those, make sure they were doing the right things, that they were prioritizing them the right way.
Yeah, as Brian had mentioned, they already had been doing some aspects of automation for a while. For us, it was how can we step back and look at your processes? The thing that we brought more than the digital workforce was really just to look at what are your processes today? How do you have them documented? And then let's look at it at the task level. And first of all, maybe a process just needs to be cleaned up. Looking at the process itself and trying to drive efficiencies, we found the automation opportunities through that. They were definitely set up for success from an automation perspective and a technology side. It was more of a question of how do we look at those processes so that we get those ready for automation, because there's a difference between a process that it just can be automated versus a process that is truly enabled and ready to be automated.
And in some cases, what was unique about our early engagement was as tried to apply technology, API development is still coming along the curve. And
Mhm.
in terms of delivering timely business value, RPA has a significant place for me. And so Matt really helped to engage and identify where maybe I could do some of these things through APIs or some sort of interface, but we could actually leverage RPA now and orchestrate that into that process.
Got it. Matt, from your perspective, what are some qualities of IU Health that have contributed to their success with the automation program, besides the incredible leadership provided by Bryan? I know he's sitting right next to you, so you'll want to point that out, of course.
Yeah, obviously. But the reality is we typically see, and I think IU Health is probably one of the best examples of there's kind of three main things that we look for pretty early on, right? And this is going to determine success from what we see. And the first is a champion, somebody who has the
Yep.
vision, somebody who's going to lead the charge and help educate the business and say, this is an enabler. This is something that the organization can capitalize on and has that vision. Without that, it gets lost very quickly, right? And so, Bryan, I was excited when we started meeting early on because he already had that vision for where this could go. It was getting
Mhm.
excited about that. That was one important aspect. The other one was process focus and process readiness. Even though there was a lot of work we had to do from a process documentation perspective, I think that they have really good individuals on the team that were ready to say, let's look at the processes, let's document them, let's get them ready for automation. And I think their team adapted to that very quickly. So the process perspective. And then the third thing is understanding how you can leverage these tools in conjunction with everything else that you have within your organization. There's obviously a lot of other aspects, but to me, that's why they've had the success that they've had.
Mm. And Bryan, perhaps you could talk about what went into the decision to select digital workforce solution to partner with you in your automation program.
Well, first, I'll say I was very fortunate to happen upon Matt. And so we met through a former colleague of his, a current colleague of mine, at the right time. I was in the early stage of that journey where like I had mentioned earlier, I had been examining vendors and what are vendors really doing in this space and comparing that to what can I do internally within my organization. And I had already established that I didn't really want to have the risk of outsourcing automation and relying on a digital workforce at the scale of some of these things that I'm talking about. And I needed to have a strong core capability to do that. So it was imperative for me to build my own program. I knew that. What was different about Matt is he engaged me at the level that I needed to be engaged to the degree that I needed to satisfy my program. So it wasn't, hey, plug me in, I'll automate things for you and then maintain these services for you. It was, hey, this is where I am in my journey. I have some RPA. I need to establish a new capability for RPA that allows for lots of controls, lots of measures, so that I don't assume risk on the kind of scale that we're talking about. And so Matt really helped me piece that together. Matt helped me with forming a team, helped me with the process to ingest opportunities, examine the opportunity, and line it up to be automated. And so
Yeah.
those components did not exist in my operation. So I had to tailor that to my program. And that's really the differentiator with DWS and Matt's leadership to guide me through that. And he was also able to meet me with the services that are required at the time. So he
Mhm.
supplemented me early with development and even support, helped me set up the environment and select Blue Prism initially to best fit my needs. And then carry me on through, hey, a maturity curve of my own team developing and starting to be able to take opportunities from beginning to end. And now we're shifting into kind of a phase where it's advisory and how we're going to move to the next level of automation.
Matt and his team really know what they're doing. That's a great approach. Bryan, I'd like you to talk about some of the key challenges you faced in your automation program, perhaps with some of the stakeholders like IT, the business operations areas, the executive team, et cetera.
So lots of challenges. I'll give you a little bit of each. In the IT space, I would say as an IT service provider, IT's perspective many times is that RPA is bad. RPA is a less sophisticated way to achieve some technology driven outcome. And yes, you can have interfaces, you can have APIs, you can have custom code, all kinds of things, custom applications that drive value. But part of value and part of my journey is that time to delivery matters. Maturity of applications matter, especially in the healthcare revenue cycle space. My challenge is there's a myriad of technologies to solve for the revenue cycle. It's not one system, it's 60 systems.
Mm.
And I'm layering all that together, trying to drive value. And there's repetition in there. There's lack of interoperability within applications and really focusing on that value statement as an IT organization and pivoting to that statement and saying, it's a necessary part of our portfolio is the conversation that had to happen, even within my own internal team. So
Mm.
I have an IT unit and I'm part of a much larger enterprise IT organization. And having that conversation on both sides, at the core, IT people don't like to do RPA. So that was one challenge on the IT front.
Mhm.
On the business front, I would highlight for anyone that's endeavoring to do RPA or automation in general, really recognizing what your process is at a detailed level, standardizing processes if they're not standardized, and focusing on, hey, there's a book of work there that needs to happen. You need to be
Mm.
engaged with operations to do that. And sometimes you got to massage out a process because you can't automate the entirety of the process. You can automate bits and components. You can still get value. And that's a level of engagement that you just have to be prepared for. You have to be prepared for conversations where people don't know the first thing about what a bot is, and how you're going to apply this technology to their process, how you're going to carve up their process and reassemble it in a way to accomplish the same thing, but just in a more efficient fashion. That has proven to be more challenging than I had anticipated out of the gate. And the way I solved for it is I actually created a small team that is focused on that very thing, engaging with operations to talk
Mhm.
about their process, understand and measure their process if they weren't already doing that. And then recognize if they had deviation from that process and saying, hey, get the 80% scenario and let's automate that. Or even the
Mhm.
20% scenario if it's a predominant scenario. Let's go and get those pieces and we can apply RPA to that. And then we can evolve that automation to more heavily automate together as they get to learn what we've already applied. So that's much more of a journey than I anticipated. And having people that are dedicated to go
Mhm.
look at it and engage in that way with the business, I felt was instrumental to getting over that hurdle. And then the last part would be on the executive side of things. We all talk about wanting technology and the efficiencies it brings. Like I said, it's been a big buzzword in my sector, the industry. But once you get down to it, once you start automating processes, you're talking about replacing work that people were formerly doing. Typically, you don't find that it's 100% of someone's job you're automating. You're automating bits and pieces of jobs,
Mhm.
and you're trying to quantify that and turn that into dollars saved on budget. And that really hits the fan at a point when you're talking about, hey, how do we plan? How do I know what to expect? How do I know what to hold my operational units to in terms of budget reductions? So converting
Yep.
efficiency to actual dollar savings is much harder than you would think it is. The way that we solved for that is I created a governance committee within my division. So it's the peer executives of mine that are responsible for operations. And we meet to collectively make the investment on the automation opportunities and establish the expectations of their units to say, hey, this is what we think the efficiency is. It calculates to this. Here's a reasonable dollar amount that we think we should be able to extract from the people cost of that operation, and then apply that accountability from the very top level. And that has been a challenge. It continues to be a challenge. No one wants to give up a buck at the end of the day, but we all do want this benefit. And we have to put our heads together and say, this is how we translate that benefit into what I can absorb on the operations end in terms of cost reductions.
Mm. It's really impressive to hear how you address those challenges with 3 different stakeholder groups, each of whom have different concerns, different perceptions, et cetera. Really impressed with that. So, Matt, change management is often a critical aspect of large scale automation projects. How did you navigate any potential resistance to change and ensure a smooth transition for the staff and the stakeholders at IU Health?
Resistance to change, that doesn't happen, right, Brad? No. In all seriousness, yeah, it is always interesting. You always find pockets, as Bryan mentioned earlier, he mentioned how with traditional IT, sometimes there's some resistance to why do we need RPA bots? It's not really something that's necessary. You've got that one side, and then you've got the other side, which is people being nervous about what does this mean for me? And I think just having lots of conversations with Bryan and team, we talk through to help them understand that this is a benefit to the various groups, right? This is really just another tool in the toolbox. Sometimes people look at it as it's a silver bullet and it's going to replace everything. And that's not true, but it does play a role, and it's very important to be able to leverage it because it's, from our perspective, very flexible, allows you to have a lot of different options, and you can go at it many different ways. And what was interesting from my perspective with IU Health versus some of our other clients that we worked with is they were more open to change, which I think speaks for the organization itself. Where it came from prior, there was a lot of resistance to change in aspects. Although there was some resistance to the change, I think overall, they actually embraced the art of what's possible. And again, as I mentioned, having a champion at the top leading that vision always helps people see where they're going. So then that resistance turns into opportunity. And I think that was kind of what helped get them through those early challenges they were coming across.
I'd like to add that one thing that Matt and DWS did that softened some of the impact of change. When I mentioned that Matt really listened to what my needs were as an internal program, I needed to have strong controls so that I could certify that piece of technology replacing humans in a way that was comfortable for our leadership. And if Matt had not met me halfway there and said, hey, Bryan, this is the right technology to use, Blue Prism in this case, to give me strong controls and insights into what I'm automating so that then I can provide a high level of lights on service for those bots to operations, I wouldn't have had as much buy-in to converting them to a bot-driven process. And so that's where we go back to our earlier conversation a little bit and say, I wanted to set this program up in a certain way, and that was instrumental. And I really do think that led to more acceptance of these changes. So I think Matt was a big part of that.
That's a great point. Thank you, Bryan. So Matt, in your ongoing role as the trusted advisor to IU Health and building their automation program, what are some of the most valuable lessons learned that could benefit other healthcare organizations as they look to do the same thing?
It's interesting. There's a lot you can learn in this space. And obviously, Bryan and the team have put in the time to learn a lot as they've gone along, which I think is helping them be even more successful in years to come. But what I think is key is having the partnership together, making sure that we're on the same page. We're meeting the needs of what the business is, because at the end of the day, if you can't run operations successfully, then everything has to falter. One of the most valuable lessons we can learn from this situation is that organizations shouldn't try to take it all on at one time. They need to find somebody who has gone through it. To be honest, I probably wouldn't have been prepared and our team wouldn't have been prepared to work with Bryan's team if we wouldn't have already been through that journey on our own, right? So prior to working with Bryan's team, I had worked for several years helping another organization start their COE. And so learning lessons there applied to, okay, Bryan, these are things that you should be aware of ahead of time. The more you learn, the more you can share, but you really need to find somebody who has that experience, that background, who's been through it before, a valuable asset to help organizations understand where they may run into some potential areas or pitfalls. Knowing that up front will hopefully help organizations save time and energy versus running into those same things time and time again. And so we were able to apply that to the IU Health situation.
Okay. Bryan, earlier you mentioned adding controls and measurements and metrics to your program, and you worked with Matt and his team to do a lot of that. I'm curious, when did you start recognizing value for the business? What was the rough timeline around that?
It was rather immediately. When I look at RPA, timeliness of delivery is one of the advantages. And we did realize that advantage. So as part of the value proposition, that was a key component. We were able to deliver very quickly. You had mentioned, we had talked about the NCAA tournament a couple of times. So when we had to mobilize and respond to an NCAA COVID bubble tournament entirely within Indianapolis, we had to register everyone for that tournament in a very short span of time. And I didn't have the mechanicals to do that. We didn't have the people to do it. We didn't have the mechanicals to quickly assemble an automated process to do that. Without RPA, I don't know that we could have accomplished it. So we received value immediately out of the gate with our rapid response to that challenge to register patients for that tournament. So that was an immediate win there. And then when I mentioned building upon the components that we used to solve for that challenge with some of the pre-registration automation and automation of insurance eligibility alerts, that all happened in a span of about 6 months. And so in my IT world, that's rapid. And you're talking about a scale of hundreds of employees that are now impacted with reduced workload. In terms of the spectrum of IT solutions I can deliver, RPA is on the very fast end of that spectrum. So I say it is a quick value, and it's why I wanted it within my portfolio. So I can say now that, hey, it is a tool that I can wield to produce value. And that's what I'm asked to do as an IT provider is provide value to the organization. Sometimes that's something quick. Sometimes that's something that takes longer. And RPA really fit my need. And so we were able to rapidly do that. And like Matt said, we've been pretty organized about what we wanted to deliver RPA. I just needed to assemble the pieces. So when he came in, DWS partnered with me. That's when we just hit the ground running and rapidly delivered it.
Beautiful. So Bryan, how would you sum up the overall impact of intelligent automation on IU Health?
We're still early in our journey of automation. So I'm gonna say that first. Even though we've accomplished quite a bit, I think there's a lot further to go, right? And we all know there's a curve there with some of these new capabilities that are out. But in terms of RPA driving that journey, what's really happened, and I didn't think it would evolve this way necessarily, but RPA has built momentum in my automation program. So I have an automation program. It's not just RPA. It's a multitude of technologies I'm using. But what RPA's done is allowed me to come out of the gate quickly with those couple of big wins that I mentioned. And even the little wins that we had, it's all built momentum with not only what I'm capable of doing in the IT space, but engagement with operations. And so once they learn to talk about how we can transform what they're doing using RPA in this case, they get more comfortable. It spurs ideas. We have a large organization. We have to build that momentum, build that comfort level. They're not used to talking about their processes in that way. And it really pulls them in to do that. Probably actually the greatest impact of doing RPA was actually that. Getting us started in this journey to say we're going to transform. Right now, we're going to do it a little bit at a time in lots of different spaces. And that's what we've done. But in terms of what have some of the outcomes been, we've saved millions of dollars in terms of efficiency. with some of the registration solutions, we've saved time that it takes the patient when they come in. If we're backed up on this pre-registration, you're not watching as the patient's waiting for you to type information in so that they then can go to the next step and be seen by their provider. So providing patient care is our ultimate mission. And some of the registration process is required for that. So streamlining that has had a direct impact to our patients, and it's had a direct impact to our efficiency. And we built so much momentum and credibility of the program. As we go do the next thing, some things are experimental, and we're trying to develop other ways of automating as well. And so it's really just established a foothold of automation for the organization.
I love the fact that you've been able to maintain that strong connection to the business operations, that you've earned their trust to have those process conversations and to be able to have an ongoing relationship where you keep automating more and more for them. That is such a incredibly important thing to maintain. And honestly, it's what a lot of automation programs struggle with. One more question to ask today, and Matt, I'm going to direct this at you. And it's a little bit of a philosophical question, but I think you're up to the task. So with the rise of automation in healthcare, how do you strike a balance between leveraging technology to improve efficiency with maintaining a human-centered approach to patient care?
It's interesting, Brad. This is something that we talk about quite a bit within our organization, just where we're focusing, how we're approaching things. But the interesting thing is, to me, what gets me the most excited about automation is actually within healthcare. Because when you think about it, when you're adding value at the end of the day to a patient or the process that impacts a patient, it's so much more satisfying than any other process that could be out there, right? Because at the end of the day, all of us are patients at one point or another. And so I think for us, it's continuing to remember that at the end of the day, how are we driving value to the organization versus looking at technology first? We actually reverse it and say, what is the value that you want to get out of your automation program? Where are you trying to go? And one of the first things we did, Bryan mentioned, was we sat down and said, but what does a business case look like? And let's make it tangible so that it's actually something we can attain in the next 2 years to 3 years. And so sitting down and thinking about what does that need to look like, right? What are we going after before we actually start executing? That is absolutely critical. That's where we can balance yes, the technology is the enabler, but at the end of the day, what's core and key is being able to make sure that we're driving value to the organization and most importantly, ultimately to the patients wherever they are. And so that all connects together. And I think it's exciting to see what's coming. I feel like it's just starting to get moving even faster in this journey, especially now with AI and everything coming to where it's going to change the way healthcare is administered. And I'm excited to see what's to come in the future.
Yeah. Well, Bryan and Matt, it has been a true pleasure talking with you today. It's really great to see how your organizations have worked together to build such an impactful automation capability there at IU Health. Intelligent automation can do so much for the healthcare industry, and you guys are living proof of that. Thank you for being on the podcast today, and I wish you both the very best.
Thanks.
Thank you.
Thanks for tuning in to Transform Now. For more insightful discussions on digital transformation and more, check out our podcast channel where you'll find all of our previous episodes. And to make sure you never miss an episode, subscribe to the show on your favorite podcast player. And if you like what you've heard, please leave us a review. For more information about digital transformation and the future of work, check out blueprism.com to learn how SS&C Blue Prism's digital workforce is enabling enterprise transformation now.